Morning, everyone. Thank you again for joining us this month. Appreciate you taking the time to come hear some updates from our team, and we'll be providing some information about sort of what's going on, as well as having time for some Q&A at the end of the presentation. So once again, we have Senior Deputy Commissioner Veronica Judy Cecil with us this morning. So appreciate you taking the time to share information, and we'll welcome you to kick us off and either share your screen or start giving some updates.
Good morning, everyone. Let me get my screen up here. Nice to see you this morning. Appreciate you all taking the time to join us live. It's always good to see a large number. Great to see how many we have on board today. I know you're very anxious to hear what the current update is for Medicaid unwinding and the restart of renewals. So I'm going to jump right in. I'm going to turn off my video while I do the presentation because it's on another screen, but I'll come back on as we have follow-up questions. If you have a question, put it in the chat and we'll try our best to get to it. Okay. So this is just our typical starting screen, just to remind folks we are here to discuss the unwinding of the public health emergency, including the restart of renewals. We've implemented numerous flexibilities both during the public health emergency and post public health emergency so that we can do our best to unwind in a way that that takes the member really into consideration and what they're going through, having not performed an annual renewal in 3 years. And for those who joined Medicaid during the public health emergency, having never had a renewal. So Kentucky has been allowed to implement multiple flexibilities to help us navigate that restart. Some of it is to help members through the renewal, and some of it is to help our workforce with all of the increased work that has come as a result of this. So these are not new flexibilities. These are the ones that we've just kind of been keeping up since the end of last year, because we think they, as we start to come towards the end of the unwinding period, are the ones that really have, I think, been really impactful, including the child renewal suspension. Any child effective from October 2023 forward that was getting an automatic renewal, and they get 12 months continuous coverage as part of that. And then the extension. So if a long-term care or 1915C waiver member is going through a renewal and is unable to respond to their renewal packet that's been sent to them by their due date, they can get up to 3 months extension to complete that and get that to us. And we are conducting additional outreach to those folks to help them with whatever they may need to get that response in. And then for all the rest of the populations, we are able to extend them an additional month if they've not responded to a notice, to give them that additional time to do so. I did want to mention, and I'll do that here since we talk about redistributing renewals, is that we have decided to redistribute around 40,000 individuals into May. So while we were originally going to wrap up the restart of renewals for someone going through their renewal for the first time since the public health emergency, we are now going to move some of the population into May, that 40,000. So our renewal period will actually end as of the end of May. A lot of folks I know are really interested in the home and community-based 1915C waivers and the flexibilities we've implemented for those individuals. We are going to, so we have had one, in order to extend these flexibilities past November 11th, which is the date they were scheduled to end. The state filed amendments to all 6 of our waivers so that we can incorporate those flexibilities, some of those flexibilities permanently as we move out of unwinding. We've had approval already for our Model 2 waiver, and that was with an effective date of 2/1, February 1st. And then we anticipate through communications with the Centers for Medicare and Medicaid Services that the rest of the waivers will be approved with an effective date of May 1st. All information around Appendix K has a separate website. It's also included on the Unwinding website. And I know we've already had a lot of questions submitted around Appendix K and waivers, and we'll get to those following the presentation. And we can talk a little bit more about that specifically at that time. So we show this every month to show what the trend is looking like in the population going through renewals and how it's impacting our enrollment. And as you can see, the decline that was anticipated, knowing that we had members that remained covered during the public health emergency, but were no longer Medicaid eligible, have dropped off. What we hope is that they've moved on to other coverage, either a qualified health plan, or maybe they're covered under an employer-sponsored plan. But you're seeing this kind of where we've leveled out a little bit, and some of that is based on our flexibilities. We have been focusing on increasing our passive renewal rate, and by that I mean if we are able to go out and verify someone's information via the data sources available to us, the trusted data sources, then we can passively renew them. There's no action they have to take. They get approved and for another 12 months. And we have been pushing some of the active renewals, folks that we can't do that passive renewal for. We've been pushing them towards the end so that we can make sure that we are implementing our flexibilities and applying those as much as we can to these renewals. So that's why you're seeing a leveling off, is because our termination rate has dropped significantly as a result of those activities. So this really busy slide is telling you a couple of things, and I'm going to walk through them. We're not going to go through every bit of the information on here, but just to let you know what you're looking at. So on the left-hand side, the original CMS monthly report, we are required by CMS on the 8th of every month to report the previous month's activities with regard to the renewals for that month. So, for example, for May, for May 23, we were originally required to file a report by June 8th for all of the processing that took place with May renewals, the approvals, the terminations, anybody that was extended or pending. So that's what you're seeing for each month from May to November on the left side. On the right side, it says updated CMS monthly report. What you're seeing there is a new requirement required for states in October last year to start updating our CMS monthly report with any pending case that was processed 90 days following the renewal month. So, for example, in May, we in our original report for May, we told CMS we had 2,698 pending cases. A pending case means that we have received a response from a member, they've provided documentation, and the state has not yet processed it. So they cross over that renewal date for May 31st. They cross over that renewal date. Something is still pending. They've been granted eligibility while that's pending. The state takes action on that information and either determines the member eligible or ineligible. So for May 2,698, we had individuals pending information that had to be processed by the state. In that 90-day period following, we processed 2,659 of those pending cases. And so on the right side there, you'll see the changes in the numbers for approvals and terminations and pending as a result of reporting that information. So you'll see on the left side, approval was 37,182. After we processed those pending cases on the right side, that brought us up to 38,552. These slides will be available, and if you really want to go through each of them just to kind of get a feel for what's going on, certainly, you're welcome to take a look at this. One question that I've gotten in the past is, as we moved through to November, that the number of pending cases really were less. And part of that is because of our flexibilities. As you will note, we have a higher approval rate, and that's because flexibilities that we are leveraging to make sure that or to increase our passive renewal and probably redistribute some of those active renewals until later in the unwinding period. So that resulted in a smaller termination rate and a smaller pending number. And let me say, all those reports are on our website. You can see both the original CMS report and the updated CMS report. So moving into our numbers that are not part of the updated report, looking at the most current information for February, we had 93,004 individuals that were up for renewal. We were able to approve 64,789 of those. Terminated or indated were 10,105, and we had just the one pending case from February. You'll see the number 18,076 are extended, and for January that number was a bit larger. In the extended population are those two flexibilities I mentioned previously, where we can extend an individual if they've not responded to a notice. And for long-term care and 1915C waiver members, that might be up to 8 to 3 months. And for everyone else, that might be up to 1 month. So the extended population is, going to reflect that those folks still have an opportunity to respond to that notice. We are tracking reinstatements. That's that far block on the right. And as of March 15th, we already have had 1,158 individuals come back in to Medicaid and reinstated. And by reinstatement, they get to go all the way back to their termination date and fill in that gap of coverage to ensure that, if there were services, that those services can now be covered. And we're tracking that back. That's a 90-day period, the reinstatement period. So we're tracking those back, as you see, for January and December, those numbers as well. I do want to mention that, so we are tracking the number of individuals that have been initiated for their first renewal following the public health emergency. And we are now, because we've initiated April renewals, we are at about 96% of the population subject to this first renewal following post the public health emergency. which means we have about 4% left. And that is that 40,000 that we moved into May have not been initiated yet. They'll be initiated next month. And just to let you know, so our March and April numbers are also a little high, like you saw in January, based on some of our redistribution. In March, we have about 116,000 that are up for renewal, and in April we have about 103,000. So fairly large numbers, but at next month's stakeholder meeting, we'll be able to share with you what the March processing looks like. So we were able in September last year to start this new demographic report, and it's out on our website. There's a lot of information that's not on this slide that really digs into at the county level the numbers of approvals and terminations. But just so you know, we do look at this and see where there are trends. We pay particular attention, if you look over in the far right, the age group, because of our suspending child renewals. We really want to make sure that that any children that are getting processed, and there may be reasons why they are, that, you know, for any child terminated, we're wanting to make sure that that is appropriate. If a child is terminated during this time, it generally is because they've either aged out, so they've turned 19, they have moved out of state, or a guardian or parent has requested that the child be disenrolled from the Medicaid program, usually because the child is being put on some other coverage. So we take a look at that just to make sure that those are appropriate. But otherwise, on the left, you see we're tracking race, and below that, gender, and then in the middle there, the ethnicity of our members. And you know, again, just trying to dive into where we may see some concerns in the numbers. Our outreach priorities really haven't changed much throughout the unwinding period. Responding to notice is just critically important for us to be able to actually determine somebody eligible or ineligible. So if they don't respond, thinking that you know, they may think they're no longer eligible, but in reality, if they would send the information in, we might be able to determine them under some other basis of eligibility. So it's important that members respond, that members know if they're in that 90-day period. So if they didn't respond, they are terminated and they go into access services, that if it's within 90 days, if they can just reach out to the state and provide the information that we need, that if they're determined eligible, we're able to retroactively give them that reinstatement period to help them. We have been doing some additional outreach around someone who what we call is categorically eligible. So they're in a category that grants that Medicaid eligibility. And if they lose that category, then they generally will lose their Medicaid, but they could be eligible under another basis. So we are trying to make sure that they understand that they need to take some additional action to get us information that we need, that we likely do not have because they were granted eligibility through their category, to make that determination and keep them covered. That's our biggest goal through this whole unwinding is to try to keep people covered. And then the fourth one there is just if they aren't Medicaid eligible, is that they have some type of coverage. So making sure they're connected to a qualified health plan and the advanced premium tax credits that can make those affordable. or, that they've taken advantage of an employer plan if they've lost their Medicaid because they're no longer eligible. We're always promoting our communication materials that are out on our website. We have several different types, and they are all there and available for friends, family members, stakeholders, advocates, providers, because we know that, this is a very difficult thing to navigate for folks, and we want to make sure that everyone is there to support them through the process. So we do have a lot of information that can be posted in the provider's office. So when a Medicaid member comes in, they can see the information and be aware of the fact that renewals are happening. We understood that that some of our members were having trouble navigating the ID proofing that's required for the self-service portal to create that account. So we created a specific flyer for that. And again, this is out there and available on our website for download and to be distributed as much as you want to take advantage of it. And even in this late part of the unwinding, if there's something that's not on there that you think would be helpful, we are always willing to create that communication if it's going to even help one member navigate the process. We always like to keep this slide on here, just making sure that members understand there are multiple ways to respond to a notice. They can fax it in or mail it in. That self-service portal I spoke about is really a great way for a member to interact with an eligibility worker, because you can upload the information, you can snap a picture on your phone and do it through the mobile, do it through your mobile your cell phone, or you can call Connect or DCBS or go visit the a local DCBS office. Or we have our fabulous connectors and insurance agents across the state that are our partners in helping folks apply for and navigate renewal of their Medicaid. They can also help anyone with navigating the qualified health plan process as well. And for providers specifically, just a reminder that we did add the redetermination date or renewal date for a member on Kentucky Health Net, so you do have access to it. And if you're checking a member's eligibility anyway, because they're coming in for an office visit or or you're working with them for services, just reminding them if you see that the date is either in that month or coming up, to remind them to keep an eye out for a notice and so that they can make sure they're taking action if action is necessary. For our long-term care members, they do that through the Kentucky level of care process. And then for 1915C waiver members, and we don't have that on here, but they can access the information through the MWMA. And just a reminder for our connectors out there that there are regular meetings and for our agents that we to try to continue to coordinate and collaborate on keeping them updated to support our Medicaid members navigating the process. Because the qualified health plan plays such an important role in our Medicaid members moving to other coverage, we've been covering that as well. The open enrollment period, the annual open enrollment period did close on January 16th. Members, anyone always has the opportunity to go out and choose a qualified health plan at any time as part of a special enrollment after a qualifying life event. And then for our Medicaid members, if they've lost coverage between March 31st, 2023 and July 31st, 2024, they have an unwinding special enrollment, and they have up until December 31st to choose a qualified health plan without any penalty, so they can go in and make that choice. So just in our past, most recent open enrollment for qualified health plans, it was we were happy to see a large number, 75,412, compared to the number last year. So again, just trying to encourage folks to access that if they're not eligible for Medicaid and don't have other coverage. And tracking, as we track the Medicaid enrollment numbers, we're tracking the qualified health plan enrollment numbers. So as you can see, at this goal line here is the 2024 number. The blue line is the 2023. So as you can see, we continue to climb, and we're always happy to see that. And always a plug for our website, lots of information out there, all of the CMS monthly reports, the stakeholder calls, all the past ones have been recorded and posted, as well as the PowerPoint presentations. But hopefully, if there's information you need, it is out there and available for you. We always ask folks that if you're not following us on social media, you just have to do one. But we do ask you either like us or follow us on Facebook, Twitter, or Instagram. We post the same information to all three, but it's always great if you could at least access one. Our stakeholder meetings, obviously, you know about because you're here today. And then just a reminder, there are lots of reports out there available for everyone, including the ones that are available for providers. And I will stop presenting and come back on. And happy to take questions.
Thank you, Veronica. That was wonderful. And we are getting very close. As you said, we're very far along and made a lot of progress, but it's good to have this information as we're still got some people going through renewals. So appreciate the updates. We had a couple questions come in from the registration as you guys signed up to attend this meeting that we'll start with. But I do see one question came into the chat, so we can get to that too. But I encourage others on the phone to chat in if they have any questions that they want answered today. So the first one I was going to ask is, you did touch on how providers can access sort of renewal information, and we've shared that in the past before too. But if a member is struggling with their renewal or figuring out how to sort of work with Medicaid and the various offices to get that approval, how can providers help from their end?
I appreciate that question. And I think providers are in a little bit different situations. For example, long-term care 1915C waiver providers have a little bit more engagement with Medicaid. And, we work very closely with them on understanding what their patients that are going through renewal and trying to support them. Their eligibility determinations are more complex because of generally the resources and assets that are taken into consideration than somebody who is just going through eligibility based on their income. So I think providers are probably in different situations based on that. If they are long-term care or 1915C waiver members, I recommend they use the current communication path that they already have available to them to escalate cases to us. I think encouraging the member to work with a connector is also because they have paths of escalating for dire needs. And so connecting the member to a connector is can be very helpful. And then, like I said, we have lots of materials. So, there could be maybe a flyer about the member renewal process and what the member, should be doing or can do to navigate that could be helpful to them. That, as I mentioned, that Connect SSP self-service portal account is another great way to encourage members to create that and be able to have that better communication with eligibility workers through the system. But we if providers have members that are really struggling, then we just ask them. You're always welcome to escalate those up. And I do want to just remind folks, and as I said, I mean, if the member has submitted information to us, and because of the workload, it might be taking us some time to get to that, processing that information. The member is supposed to still be covered during that pending time. So, and that means if it's pending for a month or 3 months, during that whole time, the member's coverage should still be effective until that gets processed. So if providers, that's another key thing, if providers are seeing members come in, they've been terminated, but they believe that the member has indicated they did respond to the notice and haven't gotten anything back, that's again another, I think, kind of flag on, then maybe that member needs to get reconnected with the state and see what we can do to find out what's going on.
Great, thank you. So one other question came in, and this is sort of about how members are being notified. This question came in specifically about members on or HCB waiver participants and how they're notified about sort of transitioning to adult SSI. But I wonder if you could speak to that specific instance and just more generally what notifications are going to members, what sort of outreach messages are in the works, and sort of the full gamut of how we're trying to contact or reach members.
Absolutely. So, and we did, I think I didn't have the most current slide on outreach. We do tend to talk about outreach specifically. So any member that is going through a renewal, it kind of depends on the information we have on their file. If they have a cell phone or a landline or we have an email address, we are trying to reach members through all the modes of communication available. So for example, if they have a cell phone, we do have a texting communication plan. So they should be receiving a text letting them know that they're going through a renewal or something has been sent to them and they need to pay attention to it. That is the first thing that happens at the start of their renewal. But as they go through their renewal process, so they get that information about 60 days prior to their renewal due date. As we move through their renewal time, we send multiple outreaches to them, as do the managed care organization. So if it is a managed care member, they are also reaching out to their enrollees to try to make sure they understand that there is something, there is an active renewal, they need to take action, and that needs to happen before that end date. So multiple contacts just from the state, because we'll send them 2 to 3 what we call nudges during that renewal time period. And then the managed care organizations are also reaching out. So they're going to get a notice in the mail, a renewal packet in the mail. If they have that SSP, that self-service portal account, they'll get something electronic in that account as well. And as I mentioned, we are doing all sorts of modes of communication to reach out. We also, so for specifically the population that I explained are categorically eligible. So SSI is a category of eligibility for Medicaid. So if someone has SSI, they are eligible for Medicaid. And if they lose that SSI, then they are likely to lose Medicaid. But they could be eligible under another basis. So on another type of assistance. So we are calling every person that falls into that population of folks who need to take action. We've sent them a renewal packet, making them aware of the fact that they're losing their eligibility. We need additional information because when somebody, as I mentioned, is in that category, there's a lot of information we don't have available to us to make a determination. So we need them to respond with that information. So we are calling, in fact, we've started on a campaign to call every single person back to May of 23 who lost Medicaid and either did not come into a qualified health plan or did not come back into Medicaid. And so we're calling all of those individuals. We're trying them 2 different days and 2 different times of the day to try to reach those folks because we just want to confirm that maybe they're fine. Maybe they've got employer insurance, maybe they've gotten coverage some other way. But we want to confirm that. And we have come across folks as part of this outreach effort. We've come across folks that have said, no, I'm not covered. I still need coverage. And we have been able to then connect them to someone who can help them, reapply to Medicaid. So that's working. It's kind of a slow process, but I think an important one for us to go back and call those folks.
Yeah, thank you. A quick touch point that came in through the chat was a question about, are the 40,000 cases that are being redistributed to May, are those a specific population or are they just moving some cases for caseload reasons?
Yeah, I appreciate that question. It is not a specific population. It is just taking 40,000 individuals and moving them into May.
We also have a comment in the chat or explanation of a case that's experiencing some issues. So, Greta, I've tracked the information you've sent into the chat. For this instance, it's looking at a crisis issue with some child coverage where Medicaid was ended in February, Veronica. So I will be able to reach out to you, Greta, following this to get a little bit more details on the case so we can help escalate this to figure it out. So I just wanted to flag that. Of course. And then I know through registration, there were a lot of questions that came in about the Appendix K and waiver changes that are coming, because I know there's been some updates there, as you even flagged. We do have a couple of our LTSS and waiver team members on the phone, so I encourage you all to speak up as these questions come, but I'll start running through what we've received. The first being that it's sort of talking about the end date. The Appendix K flexibility is shifted. This end date for that has shifted a few times, and it's now set at May 1st. But the question is, should this be expected to change again? And so it would be helpful to know for the impact to various activities and prior authorization requirements. So if you could just confirm for us what that should be, what the expectation should be.
Absolutely. Trying to predict CMS is always challenging, but because CMS has told us to expect May 1, we do not anticipate that to change. So for the other 5 waivers, we do expect approval and that confirmation. In fact, CMS, we had that conversation about we need to go ahead and provide communications to members and providers so that they can be prepared. And so, that we have gone ahead and done that. In fact, let me share. I know we're going to put the link in the chat, but this is the communication that has gone out to providers. And just so wanted to, if you've not seen this, we'll put the link in, but just letting providers know that this did go out to give notice about what's happening with those waivers and the approval as of May 1. What does that mean specifically in terms of the different flexibilities that have been in place to date? So lots of good information, and then links to other more in-depth information. We understand that this everybody's situation could be different and may not really understand how it affects that individual. And so we do encourage, case managers or members or providers to reach out and ask about specific individual situations if they are having a hard time figuring out how does that impact that member. We certainly know because this will. I mean, some of the flexibilities that have been in place are going away, and so how someone has been able to access services might change as of May 1. And we just want to make sure people are having those conversations and transitioning prior to that time.
Great. And I do see for some of those specific cases, we've got a couple instances being shared in the chat here. And so for reaching out about specific case questions, this one's specifically looking at guardian concerns. Is there a direct address or a path for escalation of those cases that we would recommend?
Yeah, I do recommend, so in the material, and we'll put it in the chat, there is a help desk and a phone number. And so I do recommend that if you have, again, a specific case, then you should try to access those.
Thank you. All right, and thank you for putting both those information, both those contact items in there. So another question around the waivers was talking about the services that were approved under level of care assessments conducted during the period where the flexibilities were in place, and wondering if they'll continue until the next round of LOC for that member, or if those services and eligibility for those services would end and require another LOC.
So yeah, as indicated in the letter, if you go out and look at the letter and the underlying information, those will end as of May 1st. I think what's important to know especially for our waiver members, and what makes this, this is for long-term care too, it can make it very complex, is that, for somebody that is 1915C, for example, they have to meet the financial eligibility of Medicaid. So there's that happens. And then they have to meet the level of care. So there are two components to eligibility for that 1915C. And so just making sure people understand, a member may still be going through a Medicaid financial eligibility renewal and determination, and that is separate from the level of care evaluation and eligibility that has to happen.
Great, thank you. I'm pulling in some links to go into the chat, making sure that they're accessible to others as well as we answer some of these questions. But continuing on, there were a couple questions that came in about the process for legally responsible guardians and knowing when individuals need to complete various forms or information or details in that process. I believe there are some materials available in FAQs, but I want to make sure I'm flagging the right thing.
I do. So yes, there are some materials already out there. I know that there is a webinar being planned by our long-term services and supports team. That should be coming out soon with specific training, and that recording can be, shared. Um, uh, I'd just like to maybe emphasize that for these members that are going through in trying to navigate this change, the case manager is really a great resource to help the member navigate that. So, and the case manager can reach out to DMS for one-on-one assistance. But don't forget that case manager is out there and should be helping the member navigate.
All right. So, will there be any sort of clarifying information coming for budget limits for waiver participants, or is that in the documents posted as well?
Yeah, and I know that can sometimes be overwhelming. We're trying our best to put this information in as easy to understand, terms as possible. But it's a lot to navigate, and I know that it creates, anytime there is change, it creates some fear and anxiety, and so that's understandable. We are here to help our members navigate that. So. Like I said, my understanding is that the DMS team has been talking with case managers, trying to help get them prepared, and for what's going to happen on May 1. So I just can't emphasize enough, making sure that you're reaching out to the case manager.
Wonderful. One other question came in about sort of waiver slots and cap on services, and just seeing if there's information that we can share at this time about those.
Um, so let me see. I might need some assistance from,
Yeah.
I might have to phone a friend on that. Um, I don't know if, I mean, so one thing when you talk about a cap, I do know that, so there's not like a lump sum budget. Everything is based on the services are based on the functional assessed needs of that individual. So the documents that we keep referring folks to, I think, address this. But if you have a specific question, once you reach out to the toll-free number or to the email.
Great.
Helen, I think Pam Smith, our director for long-term services and sports, is on, and maybe
Okay.
if you can unmute, she can offer some
Yeah,
additional information.
absolutely. Yes, let me go ahead and allow that. Okay, Pam, you should be able to unmute now.
I can. Can you hear me?
Yes, we can.
It worked great. Okay, so I think a lot of the question has been about there were some added slots, or you hear a cap for the waiver being, we can serve up to 10,500 people, or we can serve 4,000 people. There were slots that were added during the budget this last year, during the biennial budget, and those slots are included in the waiver renewal. So we're getting a lot of questions about, well, when will we see those slots? And so those are part of what's in that we're waiting for CMS to approve. But there'll be, again, as Veronica has talked about, we like to share information. In fact, I like to overshare information sometimes, but there will be specific information coming out about that as well. And really, we're going to have a couple different presentations, one targeted towards providers, one targeted towards individuals that are seeking to receive services or are receiving services right now, to really make sure that the information is in a format that's the easiest understood for the audience. So. look for that coming soon. And a plug, if you're not signed up to receive on our distribution list to receive updates, Kelly, if you can throw in the chat, if Helen, you may have already done it earlier, throw in the chat the link that people can go to sign up to get updates. That's really everything we communicate on the 1915C waivers goes out through that distribution list. So if you're not signed up for it, sign up for it, and you'll know everything that's happening.
That's great. Thank you, Pam.
Okay. So checking in a couple, I think one question came into the chat about specifics on the process of moving PT, OT, and speech therapy to services to state plans and allowing return to services under various waivers. I think, Pam, that your answer might be applicable there too, but just wanted to confirm, does that there'll be information coming as we get confirmations?
There will be. The PT, OT, and speech is specific to our brain injury waivers. But there will be more information coming. They will be moving to a true extended state plan service by CMS direction. But that will be, again, more information coming soon on that transition and some training for those providers that are just now enrolling as state plan providers on how to request authorizations.
Okay, wonderful. And then a couple similar questions are coming into the Q&A feature about sort of waiver timelines, transition of services, and communications to members. So anticipate that these will be included as well in upcoming messaging. So, okay, another question that came in there, and I'm expanding it, is talking about the renewal list from MWMA. And they've seen termination dates that are set, prior to renewal dates. And just wondering if we can speak to, as able, since I know this is sometimes complex system questions, but how the information is pulled and how to sort of understand or navigate inconsistencies when they're seen.
So again, I think the complexity of this is there is potentially a Medicaid determination, eligibility determination, a financial piece that has to happen. And then there's also the level of care. So you may be seeing two different dates as it relates to those. Pam, is there, because I don't get to see the MWMA side to this. Anything else to kind of clarify on that if they're seeing different dates?
It should be tied directly towards as far as that report should be tied towards the financial eligibility date, but it's hard to know without seeing kind of some examples. So if individuals see that, if they want to reach out to the help desk, and then we can research and see why that report maybe shows something different than what they're seeing, because the dates should be consistent across the board. There's always those weird things that just happen sometimes that no one can explain, but we will do our best to, if you can give us the example, look into it and see maybe what's wrong.
Yeah, I'll also say that I know some of the confusion might be that if somebody's returned, so let's say it's a March renewal, and somebody has actually responded to their renewal packet or request for information, and we get that in and we process it. It gets processed today. That person has been determined ineligible. Their coverage, though, their actual termination date won't be until March 31st. So they lose coverage effective April 1. So that sometimes is confusing for folks to see they've been already terminated, but that's because there's been a determination of ineligibility. Their coverage, however, their eligibility were month pure, won't end until the end of the month. So that can cause some confusion maybe in what folks may be seeing. The other thing is on the non long-term care or 1915C waiver side, is sometimes you won't see a redetermination date, a renewal date. And that is because they are categorically eligible. So they don't have an annual renewal. Their renewal period for Medicaid is until they lose that category. So that's why you'll see, as we talk through numbers, the number of individuals going through renewal during this period of time does not match the number of individuals enrolled in Medicaid, because some of those are folks that are not subject to an annual renewal.
Great, that's helpful to know. Another question that came in is specific related to timeline or deadline for providers, and when they would need to have dispersed that 85% pass-through funding to DSPs. And you might have this on hand right in the back of your memory, but if we want to take that back, we can absolutely and follow up with you, Hope, who put it into the chat.
Pam, I have to call on you again.
Well, we've been monitoring this based on the attestations that we received. So for the individuals that elected to receive that additional funding with the promise to pass through that 85%, and we are beginning to do the audits. Typically what we've seen is most providers have been kind of either using it for bonuses or they've increased the salaries. There was not a specific time frame given in that when the attestation was put out. However, the expectation was it was to help you recruit and retain individuals. So, there's a little bit of question if nothing's been done with it to this point. So I think as we start auditing and start looking with providers and talking to providers, we'll have a little bit more information about that, and we'll talk about that. But I will say, on the most part, we've had some providers that have reached out to us about some very inventive ways that they chose to use that money in, to bolster training efforts for staff, to really make staff more confident in the job that they were doing, and to help them maybe get to a higher level in a staffing position. And so it's been interesting to see how providers have used that. But we will communicate more out on that as we have to. That's one of the things, as one of our promises to CMS, we have to monitor how that 85% was used to bolster the direct support staff.
Pam, the requirement for that, does that end May 1st?
It actually continued it was one of the flexibilities that we allowed to continue until the final rates. Once the rates will go in. So it was part of the flexibility that continued. So those providers that chose to bill the 50% and pass through 85 can continue to do that until we amend the waivers again.
Thank you. Hopefully that answers the question.
Okay.
Yes, thank you so much. So I haven't seen any other questions come in, and we've only got about a minute or so left. So I do want to call everyone's attention that Kelly was able to put in the instructions for getting those updates about the waiver and what's to come. So a lot of information will be coming out. There'll be webinars, as we noted. So as Kelly has in the chat, to get those updates, you can email the team at medicaidpubliccomment@ky.gov. So I encourage everyone to do so, so that you're on the pulse of what is coming out. That would be the most efficient way to continue to get information. We will, of course, as normal or as usual, be posting the slides and recording of today's session to the PHE website that we shared the link for earlier and showcased throughout the presentation. But we will once again be having another session in April, so please feel free to register then to come and hear additional updates. But we really are grateful that you all took the time to sit with us today for this hour, to learn more, and to listen to the progress that's been made and what is remaining to help members during this PHE Unwinding time. So again, Pam, thank you, and thank you to your team for helping to support. And Veronica, as always, thank you for taking the time to present. We appreciate the information, and we will see you all soon.
Thank you, Helen. Thanks, everyone. Have a good day.